Hi everyone, and welcome to Off the Cuff, where the headlines come to life. And today we have with us Dr. Elias Zeyiad, who is a doctor of acupuncture and oriental medicine, and it is a form of alternative.
Yeah, they say alternative,
treatments?
or complementary medicine, or
Wonderful.
integrative.
Dr. Zeyiad, welcome
Thank
to
you.
Off the Cuff, and we're going to talk about acupuncture and really all the questions you wanted to ask but were afraid to, basically.
Sure.
So acupuncture and oriental medicine now it has a lot to do with the Chinese kind of environment in regards to medicine and herbs and different things, and that's how this was actually established. So explain to us what that is and how that's connected.
Yeah, so you're correct. Acupuncture actually falls under the umbrella of Chinese medicine. So Chinese medicine is a whole system of medicine that entails multiple legs. One of the major legs is acupuncture. Some of the other legs of the medicine is herbal medicine, like you mentioned. There's exercise like Tai Chi and Qigong, which are the breathing exercises and movement exercises. There's nutrition and diet. So those are all components of Chinese medicine. There's also the manual physical element with like body work, massage, medical massage, manipulations, those kind of things. Reiki, no, not so much.
That's not part of it. Okay.
You can kind
that
of
hurts. I hear.
Reiki is an energetic medicine, but not quite. It's on the umbrella of Chinese medicine. Yeah.
Okay.
So it is a whole system of medicine, and acupuncture is a big component of it. Yeah.
Okay. So I guess the question is, what do you use acupuncture for?
Pain definitely would be number one, but it actually has a wide spectrum of things it can treat, ranging from pain, ranging from side effects from cancer treatment, like your nausea and vomiting, your hot flashes, your neuropathy, women's health issues, irregular menstruation. So there's a kind of a wide spectrum. Shingles, it responds really well to shingles.
Really?
Yeah. So
while you're going through the shingles, or is it
if you're starting to have an outbreak,
Okay.
and it actually would minimize the recurrence. But if you have an outbreak, it can reduce the duration of the outbreak significantly.
And this is all documented information.
Yeah, the research base is growing quite a bit, and actually acupuncture research has been growing exponentially at a fast rate than even conventional medicine. So,
well, the FDA has removed it from the experimental kind of thing, and I know that they've done that a while ago. So it is something that is medically proven to work.
I mean, there are still detractors, for acupuncture, but the evidence is strong now, and there is a lot of evidence for a lot of conditions. And even the acupuncture needle itself is federated, FDA regulated tool now. So it's been for a little while. So
what other conditions does it help? I mean, are we looking at issues with kidneys, or is that like sort of far and removed, or is that something that acupuncture would help?
I would say with kidney stuff, if you have issues, say as kidney clearance, the filtration, or say with the liver as well, I would say more toward herbs. You could have some support with acupuncture. Acupuncture can help boost organ function, but would it say directly, disintegrate toxins and those kind of things? No, I wouldn't say that. But like I said, the spectrum is wide because acupuncture works with the brain, and it causes the brain to release various chemicals.
Because it's all the nerves. I mean, you're working with the nerve endings.
Exactly.
So
a lot of it is
that's
nerves.
That's the information that goes to the brain.
Exactly, vascular. So you're kind of, in a way, manipulating the brain in a good way, sending signals to release your natural healing chemicals. So these are your chemicals associated with pain relief, analgesia, reducing inflammation, regulating hormones. So one of the other things that really is good with acupuncture is it helps with psycho-emotional conditions. So you have your stress, your anxiety, some degree of depression. It can help regulate the hormones to a more normalized state.
Really? So okay, talk to me about that, because that's more of an emotional thing. Because when I think of acupuncture, I think of more like the physical pain in the body.
Right.
So you're saying that it helps stress and depression. So how would you? I mean, where would you? Where would you do it?
Yeah, you put them all over the place. So.
So let's say someone came in with depression and was really stressed. Clinically, maybe. Is it clinical depression or just emotional kind of?
It can be subjective. Say I feel depressed, or they can be diagnosed with depression.
Okay.
I wouldn't say for anything, say manic depression or something very severe, but it definitely helps with some degree of depression. And the needles would go all over. There'll be stuff in the ears, there'll be stuff in the hands, stuff in the feet, kind of the whole body. Because
Right.
you know, in a lot of, not only Chinese medicine, but a lot of the traditional medicines, it's the whole
Sure.
body thing. So you cannot separate the emotional and the physical, right? So if you have a physical ailment for any duration of time, there will be an emotional component to it.
Right.
And if you have an emotional issue, it can manifest physically. They call it psychosomatic, right? And now even conventional medicine is kind of coming around to that. They're realizing that it's not so
They are.
segregated.
They
You know, it's
are.
all together. So definitely interconnected.
So what would be the herbal cocktail to that?
Oh God, that's complicated. So, with Chinese medicine, Chinese herbal medicine specifically, quite different than your herbal medicine that you see, say, in the Western world, where they say, oh, you have a
Like
cold
the
coming on.
glucosamine or all
Yeah,
the
you have a
weird-
cold. Here's
weird-
echinacea.
yeah, right.
You know, it's much more sophisticated. Actually, herbal medicine is even older than acupuncture. You're talking about thousands and thousands of years old. And what's unique about it is it's formulaic in that it's not just one herb for a condition. You have large formulas based on your presentation, unique to you. So even though, say, you have a cough and Bob has a cough, the etiology, the origin of the cough, and the way it presents is different. So I will adjust the formula for you. That's going to be a little different than it is for Bob. You know, so
It's almost like compounding in
It's
pharmacy,
exactly.
but you're using
yes,
herbal.
exactly. It's exactly that way. So you'll have formulas that may have as little as 2 herbs in it. You have formulas that may have 18 herbs in it, or something like that. So
So where do you actually get the herbs from? I mean, how
so
does,
yeah. So there's
see all the questions you're afraid to ask, but
no. These are all very
need
valid
answers
questions.
to.
Absolutely. So the herbs are not quite regulated in the same way as pharmaceuticals, so not as strictly regulated. And there's various ways to administer herbs. The traditional way would be the actual raw herbs. So what they would do is they'd formalize, the decoction, they would say. They'd put the formula together and they'd boil it. There'd be directions on how to boil it, and you would drink the tea out of the herbs. That's a traditional way. And I learned that way when I was in school. The problem is compliance is low. Nobody wants to drink this really bad tasting herbal tea, because it tastes really, really bitter.
Just
usually,
stick some honey or sugar in there.
yeah.
or
Well,
no?
not if they don't suggest it's going to be therapeutic for you, But technology, of course, has come a long way, and what they're able to do now is they can make granules out of it. So it almost looks like grains, like sand grains kind of, and you can use that instead and stir it, make a tea. It's much easier. You don't have to boil it and reboil it and so on and so forth.
Right.
And even easier than that now is they encapsulate the herbs.
And I was just going to say, it's so much easier to take a pill
Yeah.
that people may, veer
Exactly.
against that. But I mean, can it be made into pill form and
Yeah.
still be as effective as
Yeah.
its raw condition?
Yeah, I would say raw is the most potent,
Sure.
but they've come with ways to really do really high concentration extracts, which are just as strong, I would say. So the technology for it has been, been great actually lately. So the thing is it's not regulated the same way. So you got to be really careful about where you get your herbs from, and you can get them anywhere. You
Right.
can go on Amazon, you can go on eBay, you can go online anywhere, and you don't know what you're getting. So, and there's been a lot of history and issues with contamination. So
Right.
you need to go to a reputable person. So people make the assumption because something is natural, it's safe. That's not the case. Definitely not the case. You have herbs that can interact with your chemotherapy. You can have herbs that enhance your chemotherapy. Those kind of things can happen. So you really need to go to somebody that's trained. So.
Well, it's definitely very, very fascinating. So let's say somebody comes in and they have had an injury and they're depressed. What would be their first course of action for you in terms of mixing the herbs and the acupuncture and let's say they had a neck injury,
Right.
and they're emotionally distressed because they haven't been able to go to work and all that other stuff. So
Yeah.
what would be the scenario for that?
Yeah, that's a very good example because that certainly happens. They would come in and I would do a consultation with them. I would ask them a series of questions. I would also do some assessments. I may do some testing, see what's involved, get more specific. I also would factor in the lifestyle, their emotional state like you talked about right now. Other factors, their sleep, their diet, those kind of things that make recommendations. They would have a treatment right there on the spot with needles. And usually the first treatment we also give them, the first consultation we also include treatment with it as well.
So we talked about, so if somebody's having a neck issue, there's so many different things that are connected. I mean, sometimes, your arm hurts, but it really isn't because of your arm. It's maybe your baby toe
Right.
that's messed up. So
Right.
how do you?
Yeah, we'll do that based on assessment, and the I would certainly needle locally to where the area is
Right.
affected, but there'll also be points where I'll needle away. So, it's funny because I'll have a patient come in for, say, knee pain, and I'll put needles in the ear. Like, well, my knee is over here. Why are you putting needles in my ear? And I have to explain to them that there's a systemic effect and there's connections. So
The nerve connections in the body.
yeah, the nerve vascular connections,
Right.
and now even with more research recently, we used to see the traditional Chinese medicine diagram with all these channels and lines, they call channels or meridians. That was like a traditional kind of language, but now we understand those channels and meridians, they actually are connected to what we call fascia or connective tissue. And interestingly enough, connective tissue goes all over the body, just like
Right.
these channels did, So there's some research that came out of New England. There's over 80% correspondence between these channels and these connective tissue planes. So you have planes that traverse the entire body. So you could manipulate something far away to elicit an effect on the other end, So
So what about the elderly? I mean, you sort of get older, and you can sort of get these aches and pains, and
Yeah.
the arthritis and all these different things, and you just sort of get a little bit slower. Now, what would acupuncture do for them, or would it?
Yeah, it would just try to help improve the quality of life a bit. So a lot of people come in with arthritis, like you said, osteoarthritis, rheumatoid arthritis. A lot of elderly are depressed too. They have,
Sure.
so they feel lonely. They feel
Well,
maybe
living in
neglected.
Michigan,
Yeah.
I think a lot of people, especially when you get seasonal depression, because there's no sun, there's no, you people, and it's 5 o'clock and it's late. I mean, is that something that you would address
Yeah,
as
it's
well?
like seasonal affect disorder.
Yeah,
Absolutely.
absolutely.
So, a lot of people use acupuncture for maintenance too. It's not necessarily that you have to wait until something happens. You can do it preventatively or just for kind of general well-being. I have patients come in all the time saying, I need a tune-up.
boost.
Yeah, I need a boost. I need a tune-up, kind of thing. So, for the elderly, it'd be stuff like trying to minimize degeneration. Say we're all going to have degeneration over time. Reduce pain, because you've aged your body, a lot of mileage on there. So yeah.
So do you automatically integrate herbs with the acupuncture, or is that per case basis?
Per case basis, and not always, and also depends too. They may be on a lot of medications.
Right, and the interaction.
The
with that.
interactions, yeah. So also there's practically speaking, there's a financial component too, because actually both of these services, at least in Michigan, it's not covered, by insurance. In other places in the United States, on the West Coast, I lived in Seattle for a while. They cover acupuncture. A lot of places in New England, they cover acupuncture, but they still didn't cover herbs. Herbs always comes out of pocket.
Right.
So there's that component.
So acupuncture, excuse me, is not covered in Michigan at all? I mean,
No,
are there any components that are covered?
No, there are some tangential ways to get coverage. So, for instance, I mentioned personal injury protection claims, so
Right.
accidents. Workers' compensation usually covers. If you have like a flex spending account or a health savings account, they usually cover it. And now, actually, what they've been doing now, the veterans have been getting coverage too. So they have a Veterans Choice program. So they've been getting coverage for acupuncture, for massage, for chiropractic services too. Yeah.
So the next question is, does it hurt?
No.
When you do it.
That's one of the most common questions we get. No, there are sensations involved with it, yes. But what I call it painful, no. So, and it also depends on the style of the acupuncturist too. Some acupuncturists have a very passive style where they just put the needle in very shallowly and leave it alone. Some do more aggressive techniques where they try to elicit certain sensations or twitches in the muscle to help release them and so on. But they're not painful. I want to characterize them as painful. The most common description I get from patients is that it feels weird. That's the most common description. I get that all the time. It feels weird. I don't know how to describe it. It feels weird.
And how many sessions do you need to find results?
Good question. So definitely depends on the presentation and the patient. What I tell patients is what I like to see is some change, small, even if it's small, within 1 or 2 treatments. I do say, have I had patients come in and get one treatment and have resolution of symptoms or significant reduction? It happens, but it's rare. Have I had patients go through a series of treatments and not get anywhere? That happens too. So it's just like any other medical intervention, there's no guarantee. Usually the answer is somewhere in between. I would say akin to physical therapy, you have to go through a series.
Sure.
Yeah. So I would say some change within 1 or 2, something small at least. More significant for 5 treatments. Then I would recommend that they continue treatment as long as they're making progress. Once it starts to plateau and even out, either they have resolution of symptoms or that we're not getting any further, then we can.
And what's the percentage of that happening?
Oh God, I don't know if there's been good data. It depends on the condition, So I would say for a lot of pain conditions, it depends. Say osteoarthritis responds really well. Shingles responds really well. Chemotherapy-induced neuropathy responds really well. Over 50% in both those cases, I would say easily. So some conditions harder than others. Some take longer duration. Some depends on the age of the patient. I tend to find that younger people respond much more quickly, especially for traumatic injuries, than older people. Kids respond more quickly as well. They're much more resilient.
What about conditions like fibromyalgia, which is, it is the nerves and everything, and lupus and things like that. I mean, what's your success rate with those?
Yeah, I haven't seen too much fibromyalgia or lupus for that matter. I have seen a little bit, and there has been more research recently that's shown that acupuncture is beneficial for fibromyalgia, and it seems kind of counterintuitive because you're sticking needles in a patient that's feeling pain everywhere,
right?
But they're actually quite tolerant, Yeah, so there has been some research that suggests that there is benefit to that. Yeah.
Okay, well, so I'm going to try this. I'm going to be very, very brave, and I'm going to try it.
Okay.
So
let me get the biggest needle out I have.
No. That wasn't the agreement.
That wasn't the deal.
That wasn't the deal. So we're gonna stick to the deal. So,
okay.
So we're gonna do this. So what's the duration? How long do you have to keep the needle in per session to actually have it be effective?
I would say
as a session.
Yeah, there's variation depending on the approach and the intention. I would say the range is 15 minutes up to 40 minutes, retention. I would say average is about half hour retention.
So you do have to sit there for a half hour with the needles in. Yeah. But we're not going to do that.
No. We're just going to be very, very brief.
Okay.
And contrary to what people may think, you're sitting with a bunch of needles in like a pincushion maybe, but it's actually quite relaxing. So very commonly I have patients become very relaxed, they fall asleep, they start snoring. I've had patients talk in their sleep, those kind of things. So it's actually a very positive experience for some people,
Okay.
Yeah, so nothing to be alarmed about. So.
All right. Well, I have to tell you, when I knew you were coming on the show, I actually asked for volunteers, and it was like I got a few awkward comments. Yeah. So it was like, okay, it's me. Yeah. So I'm volunteering to do this. So let's do it. Let's get started here.
Yeah.
I'll let you know if I'm going to live
yeah.
through this or not.
You want to sign a waiver here? No. So one of the first questions I get about acupuncture is the size of the needle.
Right. That was the first thing I asked you. What was
the size of the needle.
So I went the smallest one you got.
Yeah, I'm going to do a small one.
Okay.
They're on average 1/4 millimeter thick, and I don't know if you guys can zoom in on this.
Okay. Yeah, it's very small.
It's very, very small. So these are solid filiform needles, meaning that they are. It's not hollow. There's no fluid in there that's going to be injected. It's just solid stainless steel.
Right.
They're only about 1/4 millimeter thick. I used to work in emergency medicine many years ago, and I used IVs and did blood draws. You can stick a bunch of these needles into one of those needles.
Right.
Yeah,
right.
And you can see it's very flexible, like a hair.
Right.
Yeah.
Okay.
So very, very, very thin.
Okay.
So that's an acupuncture needle. Now they will vary in length depending on where I'm putting the needle in. Depending on the size of the patient, obviously. So this is like a very commonly used size, is about 1 inch.
Okay.
We have needles that are.
Can I?
Yes, yeah, here.
Let's see here. See how sharp it is. Okay.
Yeah.
Ow. Yeah. Okay.
Yeah. And
it's like a little wire thing, right?
Yeah, it's like a wire.
Okay.
You have some see that even smaller. I use these for the ears. They're only about 1/2 inch.
Okay.
Yeah. And
so why would you put them in? I mean, I know the concept of, but specifically, why would you put them in the ears? What kind of conditions would you have to put them in the ears?
That's kind of supportive for the rest of the body. The ear is a whole microsystem, and interestingly enough, it's not even Chinese; it's French.
Okay.
Yeah, it was discovered by a French neurologist who had a patient with sciatica, and was not getting anywhere with the sciatica patient. This patient got frustrated, went to a local healer in the French village, comes back to the neurologist and says, "My pain is gone." And the doctor asked, "Well, what did you do?" And they said, "Well, this doctor, singed or cauterized a part of the ear, a little part of the ear." And this catalyzed a bunch of research for this neurologist. And what he did is that he was able to map out the entire body in the ear. So we use it as a kind of, at least I use it as a supplement to the rest of the body. So if you're having knee pain, there's a knee portion of the ear. If you're having shoulder pain, there's a shoulder portion of the ear. You know, those kind of things.
I actually read a report that said somehow they can predict different kinds of conditions within the body from the shape of the ear and the way, you know, the eardrum is and the whole thing. And I thought that was fascinating.
Yeah, even in conventional medicine, they've found that, like for instance, a lobe, if it has a certain crease in it, you're higher propensity to certain cardiac conditions, you know, those kind of things.
Right.
So
it had a relation to the cardiac.
Yeah, they found
health.
some kind of connection there. Also, ear acupuncture is very common for addiction. And now the military is using it, actually. So they call it battlefield acupuncture. So they've been using it for pain, both on the field and at their bases, and for PTSD and other conditions. So it's come a long way.
That's great.
It's come a long way.
Let's
ready?
do this before I change my mind.
Okay. Let's get you a fresh needle here.
Yes, please.
Yeah. So I'm going to put this away.
Okay. And yeah, now you have to do that to every part of where you're going to put it?
Yeah, we're going to put the needle.
Okay.
So this is kind of, we have to go through a certain, in addition to our training, we have to have certification, of course, for sanitary procedures. So we'll put, actually let's do, we'll put them close together here so you can kind of feel them there.
Okay.
Okay. I had this one saved for Siham, but I'm gonna spare her this one. That's a 5-inch needle.
Yeah,
so
no, that's not happening.
So we use this for people that have hip pain if they have a really big patient. So the spectrum is wide.
Okay.
But you've been nice to me.
So yeah,
you've been nice to me.
Okay, so there's different levels.
Different lengths. Yeah, just depends on where you're going and the intent and how big the patient is. So you'll see there's a plastic guide tube there.
Right.
So what this will do is it'll provide some guidance. I can move structures out of the way with this, you know. So I put a little pressure there. Okay, so you'll feel that pressure. You see a little dot there. A little pressure there, and I'm going to do a quick tap. I just tapped it in. Okay, did you feel much of anything?
I felt nothing.
Okay, I'm going to insert
nothing.
it. So depending on the intent of the acupuncturist, they may feel a spectrum of sensations, and if I manipulate it a bit, you would feel more. But they may feel a dull aching sensation. They may feel some pressure or fullness. You may feel some travel. So for instance, if I were to play with this a little bit, you might feel something come down your hand like that. You might feel like a twitch too. Those are all normal. Those are all desirable
now I'm
sensations.
starting to feel.
You feel something?
Like something right in through here.
Are you feeling some achiness or anything like that?
A little bit.
Yeah.
Just a little.
Yeah,
but
and that's it.
Fine.
That's totally normal.
Okay.
And that's good because you can actually create a stimulus to the brain. So you have stimulating the periphery to affect the brain itself. To release different chemicals. So now we'll put one more in.
Okay.
Because I'm going to show you an accessory that we use as well with acupuncture.
Okay. Bob, are you handling this okay? He has a hard time with this stuff. He was not going to volunteer. Okay.
So, and these, right now I'm putting needles in just arbitrarily. This is more for convenience for the camera.
Arbitrary?
Yeah.
No, for the convenience. Don't do anything for convenience.
No. I'm not treating anything
okay,
in particular.
that I felt.
Yeah, I'm not treating anything in particular.
Okay.
Yeah, just to show.
Okay. Safely show.
Yeah, to safely show, of course. Yeah. So there's a couple of needles that are in there right now.
They're fine.
Yeah, they're not bad, right? So now I'll put one of the accessories that we use is called an electroacupuncture machine. So those of you that maybe have been through physical therapy, maybe are familiar with a TENS pad or TENS unit where they put like a sticky pad.
Right, I was just going to say a TENS unit where they put it down the back sometimes and the electrical current goes through them.
Very, very similar.
Okay.
Only difference is we add the needle cables to the needle itself. So very, very...
Okay, I didn't agree to this, but...
very, very small current.
Okay.
Very, very small current.
Okay.
And that's it. So we're going to put that on there.
Okay, now I can feel the achiness in the hand a little bit.
You feel it? Okay,
right,
yeah, and that's normal.
Okay.
Okay. And all the patient will feel is some tapping. You'll feel this.
Okay.
That's all you're going to feel.
Okay.
So, and we'll go very slow. I go very slow with my patients. You'll just feel a little... when you feel tapping, let me know. And you might even see like a little jump a little bit.
Okay. Am I feeling it?
I'm going really slowly, so it might take a second.
All right. There you go.
Do you see it going?
Yep.
That's
I
it.
feel the tapping in there.
Yeah. So it depends, on the patient's presentation, their tolerance. I'll adjust.
Sort of got a rhythm to it.
Yeah, it goes do. And depending on the frequency you use, it can elicit different effects. Some are good for analgesic effects, some are good for tissue healing, those kind of things. So that's a tool that we use, and that's it. So I'll take that one out. Turn it off. We'll take this out. You're still alive?
I am.
Okay.
I am. I mean, there was no discomfort whatsoever.
Yeah.
So the actual benefits of doing this come after how many treatments? I know it would depend on the actual physical condition that you're treating, but do you have like an average? Because first of all, it can get very expensive.
There's definitely that issue as well, and I try to be sensitive about that. I'll just take these out. So that's it. Yeah. Sometimes you may feel a residual achiness or sensation. Needle might still be there, especially if you're sitting there for 15, 30 minutes.
Right.
So that happens.
Right.
As far as the benefit. So, like I said, it's very, very hard to
I'm sorry.
to gauge. Are you right?
Yeah, Bob just gave me a 3-minute warning with needles inside the 3. So, okay, made me giggle.
All right. So yeah, the benefit's kind of hard to gauge as far as response. There are a certain percentage of the population, we don't know exactly what percentage, that do not respond at all. And what they found with certain research is that they have, if they have elevated levels of, say, a chemical called cholecystokinin, that they may not respond at all to acupuncture. So hard to gauge. But like I said, I would say within 1 or 2 treatments, you should feel a little something.
1 or 2 treatments
something minor.
should be the gauge.
Yeah, a little bit of a gauge. Either if you don't feel anything by then, either you're not going to be
responsive.
You may not be responsive, but I would say give it 4 or 5 to see. After that, if you have some response, about 4 or 5 to see if you get something more significant. Yeah.
So, can you talk about the cost? I mean, what would a average treatment cost?
Yeah. So at least at Henry Ford I can speak, and this is actually comparable to even private clinics. The initial consultation is $139.
Okay.
And then follow-up consultations, or rather follow-up treatments, are $88.
Okay.
And this is pretty consistent.
Now, does that include the herbal thing together?
The herbal is separate.
Okay, the herbal is
but
separate.
if you could get the herbal consultation is weaved in there.
Okay.
So I might say you come in for acupuncture treatment, and I say, well, maybe you should have this formula too, based on my assessment. You don't get charged extra for the herbal assessment, right? But you still have to pay for the herbs separately.
Really quick, in your estimation, have you found more success with the combination of the herb and the acupuncture?
Yeah.
Okay, so that usually goes hand in hand.
That's ideal, yeah. Yeah, I would say that.
And then again, you got to be really careful in regards to your diet too, because a lot of that stuff can sort of interact and the medication that you're on. So all that has to be the conversation within the consultation.
That's why I don't recommend that you just go online and do a search and buy something. You have to really go to somebody that's trained and qualified.
Right, and then the ingredients, you never know what's in there.
Yeah, and the quality. So we at Henry Ford, I know for certain we make sure that the supplements and herbs we carry are high quality, pharmaceutical grade.
Is there a website that people can go to find you and find this information from Henry Ford?
If you go to henryford.com/CIM, Center for Integrative Medicine, you'll find us.
We'll put that up on the screen as well. So thank you so much. This was interesting, and I guess I have to thank you for poking me with needles. But,
thank you for being a good.
It was good. It wasn't as bad as I thought. I mean, I've never done it before, so this was a great experience, and I have always thought about doing it because it's been recommended so many times. So this was definitely a good acupuncture 101.
Yeah, I hope I alleviate some fears and answer some questions.
Absolutely. Thank you so
Siham.
much.
I appreciate it.
Dr. Zeyiad, for being with us. And again, he is a doctor of acupuncture and oriental medicine, so very informative. And thank you all. I hope you learned something today, and maybe acupuncture is for you. Find out. Have a wonderful day. We'll see you soon.